بسم الله الرحمن الرحيم. أنا الدكتور محمد ستيت، أستاذ مساعد جراحة المخ والأعصاب. النهاردة بإذن الله هنتكلم على موضوع اللمبر ديسك prolapse. Lumbar disc prolapse means herniation of the disc material through the lumbar canal with compression on the neural structure, cecal sac or nerve roots. Causes of lumbar disc prolapse: trauma, degenerative changes of the spine, and increased intradiscal pressure as in prolonged sitting or carrying heavy objects. The most important factor in assessing a patient with low back pain is the presence of symptoms or signs of nerve root compressions like leg pain or even sensory symptoms. Sciatica, it's a pain along the distribution of the sciatic nerve, and it is most common cause of lumbar disc prolapse. Lumbar disc. The anatomy of the lumbar disc consists of annulus fibrosus and nucleus bulbosus. The most common level of lumbar disc prolapse is between L4 and L5 vertebrae. The lumbar disc may herniate as a one unit, or the nucleus may rupture through the annulus. The lumbar disc prolapse usually occurs in a posterolateral direction. Less frequently, the lumbar disc goes laterally and traps the nerve root at the neural foramina. Here we can see a picture showing the lumbar disc prolapse and the nerve root compression. How we can assess our patients? There are important issues to be taken in mind when assessing the patient with lumbar disc prolapse, like history taking, patient complaint as a low back pain, sciatica, analysis of the patient complaint, sensory, motor, and sphincteric assessment. Clinical assessment of the patient, for example, assessing lumbar movement, straightly grazing test, motor, sensory, and reflex evaluation. We can summarize here the clinical pictures of the most common levels of lumbar disc prolapse: L5S1, L4-5, and L3-4. The investigations. We have different ways which can be used in diagnose a patient with lumbar disc prolapse. Plain X-ray lumbosacral spine may give us some data like lumbar curve condition, narrowing of the disc space, spondylolisthesis. Number 2, lumbar myelography. Now it's not longer be used in the era of CT and the MRI lumbosacral spine because of its invasive maneuver due to dye injection. Here we have an example of plain X-ray lumbosacral spine, lateral view showing narrowing disc space at L5S1 segment. This slide shows a lumbar myelography of the patient with dye restriction due to lumbar disc prolapse. MRI, or magnetic resonant image. It is the investigation of a choice in diagnosis of lumbar disc prolapse. It gives us an idea about the prolapsed disc level and nerve root compression. This slide shows an MRI views of the patient with lumbar disc prolapse. As regards the treatment of patient with lumbar disc prolapse, most of the patients with sciatica achieve good pain control with conservative treatment. Conservative treatment consists of bed rest 2 to 4 days, non-steroidal anti-inflammatory drugs, muscle relaxants, and corticosteroids may be sometimes used. Surgical treatment of patient with lumbar disc prolapse. Indication of surgery here when failed medical treatment or presence of motor deficit. Aim of surgery is to decompress the nerve root affected by the fragmented disc material. Surgery may be consists of complete or partial laminectomy or percutaneous endoscopic discectomy. Thank you.